Hey everyone, my name is Nick Cameretti. I'm our Senior Director of Strategic Partnerships here at Arcadia, and we're going to be spending some time walking through ways to deliver insights as it relates to value-based care performance and care coordination at the point of care.
Thank you, Nick. Great to meet you all. My name is Tim Barry. I'm with Vim. I lead a number of strategic growth initiatives here at Vim. Very excited to talk about our new partnership with Arcadia and the great work that we're doing together. So what is Vim? We are a middleware company that has built a powerful and flexible platform that integrates with the most common EHRs. And we work with a number of different customers and partners to surface data and actionable insights directly at the point of care. And as we think about what we've built, there are a couple of key differentiators that I'll call out now. So the first is our low-lift integration. So Vim is a solution that can be deployed at scale in as fast as a couple of clicks. So for example, it can be deployed as a Chrome extension in a single phone call. And any of our customers that have, for example, group policy capabilities, they can deploy across their connected footprint. And as an organization, we are very focused on making the deployment as seamless and efficient as possible so that our providers can really focus on delivering the maximum value and impact. Two, there are a number of advanced workflow capabilities that are inherent in our platform. A couple of these that I'll touch upon that are very relevant to the partnership today. One is the ability to have full context awareness. And really what that means is that we can read and write and identify relevant context from the EHR. So for example, if there's a patient in an encounter, we can recognize the PII or any of the clinical context and surface relevant data on that patient for a PCP. We also have the ability to have full write-back, meaning we can take data that has historically been outside of workflow, outside of the EHR, and with the click of a button, we can write that into the progress note or a patient chart and automate that process. We also have the ability to power full data extraction, so we can do chart retrieval or extract specific data elements from the EHR for a number of different use cases. And ultimately, what this leads to is reducing administrative burden and improving provider experience across our network. Speaking of which, we have over 2,000 provider groups that are currently live, or provider organizations that are live with us, and that's something that is growing every single day. And as we look to the partnership with Arcadia, we see significant opportunity to continue to expand that network across the US. So there are really two distinct ways that we work with our partners and customers. First, we have the ability to host native applications through our developer platform and create native applications available directly within the EHR. And that's something that we'll talk to with Nick here and what that could look like in partnership with Arcadia. We also have a suite of existing applications that are available natively out of the box to power use cases such as risk adjustment, surfacing quality gaps, et cetera. Here you'll see an example of our lightweight solution. That is an intuitive overlay that sits on top of the EHR, and we can surface all of these different data elements depending on the use case of our partners and customers. And with that, I'll hand it off to Nick to talk through Arcadia and the vision we have for this partnership together.
So Arcadia, who are we? We are a healthcare data and analytics company that is a history in the value-based care and population health landscape. So as we think about Vim and this opportunity, at the end of the day, Arcadia has been focused around creating a large mesh of healthcare data for the organizations that we work with. So you think about the platform for Arcadia today, the starting point, as you can see on the left here, is all of the different data sources that are coming into the platform. So as we think about that mesh of healthcare data, we're looking to create the most comprehensive overview of the members or the patients that are a part of an organization that we work with. From there, we're applying a whole host of different analytic capabilities to that data asset. As we think about some of the core value-based care concepts, risk adjustment, quality performance, cost and utilization, we have a HEDIS certified quality measure engine where we're calculating quality gaps for our members and our patients across the ecosystem. We're running a whole host of different risk adjustment algorithms across that data set. And so as we think about the value that can be driven to the point of care around care gaps, care coordination, that's where we're really kind of focused in this conversation, this partnership with Vim. So today, Arcadia has a few different ways in which we engage the different individuals at the point of care and throughout the care ecosystem. So as we think about the physicians, the clinicians, the analysts, and those that are working with not just your patients and your members every day, but with the providers to drive better performance across your provider network. We have what we refer to today as our desktop and our Inform application. There are a few different ways in which we deploy these insights to the point of care, to where the provider is interacting with the member or the patient today. So as I mentioned, we have our desktop and our Inform applications, which are Arcadia developed. And then today we're talking about a new deployment methodology here in the partnership with Vim. So as we think about the partnership between Arcadia and Vim, we have a really great opportunity to change this experience both for the providers as well as the members and the patients across the ecosystem. So as we mentioned, Arcadia's core competency is creating that tight mesh of data across a given customer's landscape. So as we think about claims data, clinical data, supplemental data that it's driving care gap closure, the goal is to create that very tight mesh as a starting point where we're then applying the analytics. And then we look to an organization like Vim that's very powerful in the middleware space to help deploy that insight to the point of care.
Yep, absolutely right, Nick. We think of the ability to leverage Arcadia's best-in-class analytics and the output of all the algorithms and great work that they're doing directly in the EHR at the point of care. So how we are envisioning this, to start, we're going to leverage Vim's existing suite of applications. So for example, our HCC or risk adjustment application, we will ingest HCCs and suspect and recapture codes from Arcadia and make that available across our connected footprint. What we get very excited about as we look to the future of this partnership is our Vim Canvas or developer platform capabilities. So it's the ability for Arcadia to co-develop or develop new applications on top of the Vim UI to surface whatever insights or output they want to their providers at the point of care. If you think about the different possibilities, it really becomes endless. And then finally, to wrap up, some of the key tenets of this partnership and what really excites us. One is the user experience. So through the Vim unified platform, whether it's leveraging the core applications or the novel applications that we can co-develop together, it will be a consistent user experience to interact with that actionable data directly at the point of care. Scalability, the delivery of these novel applications can happen immediately. So anything we develop together, we can surface the output of that at the point of care across the different EHRs that we can integrate with. And we can take this to all of the connected providers that Vim is currently working with and the new providers that we can onboard together.
As we think about innovation, this is one of the areas we're really excited about the partnership with Vim. Today, as mentioned, they have the Vim core applications, which really kind of mirror a very close experience to what we have out of the box with our desktop and our Inform tools. But as we think about the Vim Canvas developer suite, this really gives us a platform to drive more of the capabilities that Arcadia has in-house today and that we're exploring as we think about generative AI, next best actions, and care coordination to the point of care. So instead of having to break away from that workflow, being in the EHR at the point of care, logging into a different tool within the Arcadia ecosystem, Vim is a solution and a partner for us where we're able to drive more and more of that experience right back into the native workflows that providers have today. And as we think about outcomes, at the end of the day, the goal is that we're using the insights that Arcadia is driving to impact care at the point of care. And so through this partnership, we see a really strong opportunity to be able to support that journey and provide a greater ROI for the organizations that we're working with. All right, well, thank you for joining us.
Thank you, everyone.
Enjoy the rest
Appreciate
of
the
your
time.
day.